What if I told you that one common pill in your medicine cabinet could double your risk of dementia, another could break your hip, and another could quietly steal your independence without you ever noticing? If you or someone you love is over 65, do not skip this video because one of these medications is now being called a public health crisis. Most people believe that if a doctor prescribes a medication, it must be safe. But here's the truth no one talks about. Many drugs that are safe for younger adults can become dangerous, devastating after age 65. These medications are not rare. They're some of the most commonly prescribed in America, taken daily by millions of seniors, often for years, without realizing they've been linked to memory loss, falls, broken hips, and even early death. By the end of this video, you'll know the 5 medications I would never let my loved one over 65 take and the safer options you should know about. Stay until number 1 because it's the most dangerous and the least discussed. Before we begin, ask yourself this one important question. How many medications does your loved one take every single day? And has anyone ever truly explained the long-term risks? Let's start. Millions of seniors reach for this drug every night believing it's harmless. Benadryl, Tylenol PM, Advil PM, ZZQuil. These products are everywhere. No prescription required, inexpensive, and incredibly easy to buy. And that easy access is exactly what makes them dangerous. These medications contain diphenhydramine, a powerful anticholinergic drug. Anticholinergics block acetylcholine, a chemical your brain relies on for memory, learning, attention, and focus. When this chemical is blocked repeatedly, especially in older adults, the brain begins to suffer. Large long-term studies have found that seniors who regularly used anticholinergic drugs for several years had a dramatically higher risk of developing dementia. Aging makes this even worse. Older bodies clear medications far more slowly, meaning a dose that wears off in a few hours for a younger adult can linger for 12 hours or more in someone over 65. That means the brain stays suppressed night after night, year after year. What makes this truly frightening is that many seniors don't even realize they're taking this drug. Diphenhydramine hides in allergy pills, cold medicines, and sleep products under dozens of different brand names. Later in this video, I'll explain how seniors can sleep better without sedating their brain, so make sure you stay. Coming in at number 4 are acid reflux medications like Prilosec, Nexium, and Prevacid. These drugs work extremely well at reducing heartburn and acid reflux, which is why they're so commonly prescribed. But when used long-term, they can quietly weaken the entire body. What most people aren't told is that stomach acid isn't bad. It's essential. It helps absorb calcium and magnesium, kills dangerous bacteria, and allows food to be properly digested. When stomach acid is suppressed for months or years, serious problems can develop. Bones weaken, fracture risk increases, dangerous gut infections become more common, and cognitive health may suffer. Here's a sobering statistic. A hip fracture in someone over the age of 65 carries a 20 to 30% risk of death within 1 year. That's not a minor side effect, that's life-altering. Coming up, I'll explain why lifestyle changes often work better than these drugs and how many seniors can safely taper off with medical guidance. This category includes medications like Xanax, Valium, Ativan, and Klonopin. Doctors have prescribed these drugs for decades to treat anxiety and sleep problems. But in seniors, they are especially dangerous. These medications slow the brain. That leads to slower reaction times, poor balance, increased confusion, and a severe risk of falling. Studies consistently show that seniors taking benzodiazepines are far more likely to fall, more likely to experience memory decline, and at a higher risk of developing dementia. Falls in older adults are not minor accidents. One fall can mean the loss of independence, permanent nursing home placement, or even death. Even worse, these drugs were designed for short-term use, yet many seniors have been taking them for years or decades. Stopping suddenly can be dangerous, which is why later I'll explain how safe tapering works and what can replace these medications without painful withdrawal. This one affects millions of older adults. Drugs like oxycodone, hydrocodone, morphine, and fentanyl are prescribed for pain, and adults over 65 receive more opioid prescriptions than any other age group in seniors. Opioids commonly cause extreme dizziness, severe constipation, confusion, and dangerous falls. One major study found that fall risk increased by 400% in the first 2 weeks of opioid use. for 100%. And here's something most people don't know. Long-term opioid use can actually make pain worse over time. This is known as opioid-induced hyperalgesia, where the brain becomes more sensitive to pain rather than less. In just a moment, I'll reveal why non-drug pain treatments often work better than opioids while protecting the brain. This is the most dangerous medication on the list, and almost no one talks about it. Bladder medications like oxybutynin, tolterdine, and vesicare are prescribed for overactive bladder, a condition that deeply affects dignity and quality of life. But here's the devastating trade-off. These drugs may steal brain function in exchange for bladder control. They are among the strongest anticholinergics commonly given to seniors. Large studies show a significant increase in dementia risk, with measurable cognitive decline appearing in weeks, not years. Families often miss the warning signs. Memory slips, confusion increases. Everyone assumes it's just normal aging, but in many cases, it may be the medication. The good news is that better options exist, including behavioral strategies, pelvic floor exercises, and newer medications that do not block critical brain chemicals. Here's the truth. These medications are not inherently bad, but aging changes everything. Metabolism slows, brains become more sensitive, the body clears drugs less efficiently. What was once safe can quietly become risky. Your loved ones deserve full information, safer alternatives, and a voice in their care. Share this video with anyone who has a parent, grandparent, or loved one over 65. One honest conversation could protect their memory, their mobility, and their independence.